We have indeed all the scientific evidence, but then some startups, they still want to reprove the things that are already proven. Well, what you say is just take the playbooks that already exist and experiment based on top of that.
I think that the existing medical literature contains a near exhaustive list of all the clinical interventions that are needed to succeed in value-based care and in healthcare in general. The question is, how do you sort through that list? How do you pick the interventions that are going to be most impactful for the patient population that you're working with? And then to kind of organize that set of interventions that you choose to be executed. I think that's where the human-centered design process and some engineering processes come into play, because it's one thing if your company is just doing one intervention, that's hard enough to implement. But at a place like Oak Street, we have dozens of simultaneous interventions that we're trying to execute, often through the same clinical care team. And so that really requires a lot of in-depth collaboration with the folks doing the work and figuring out how to make it easy for them to succeed. I am certain that I'm every day missing lots of very valuable medical literature. I think some of it comes from just working for 25 years in the same niche of primary care for adults. There's probably something brand new today that I don't know about, but the stuff that people have been working on for literally decades for improving outcomes in this population, by now I've stumbled upon it or been educated by others. We don't have to necessarily be on the cutting edge. Sometimes it's just something that's been proven for decades to work that for some reason no one's doing.